are tired. Hi, Jumana. What about your origami? Is it with yourself?
Yeah.
Could you show to the boys?
Yeah, I can show it to the boys. I actually stored the post-it notes that we had.
Come here. In pediatric wards, you can produce from this origami for the children.
So I made like
You have classes for teaching this origami?
yes, I was taught in Norway. We had like a course where you do origami
Of
after.
course.
Yeah. They teach us because it's like a fun thing to do also. So you can make, you already know I make small hearts out of paper. But like this box is amazing, let me show you. So what you can do is, you fold it like
She
that.
said at the first session I didn't have any talent.
Yeah, I realized I do. Here, that's a box. You can like store small things out of paper. You can use this like as another box. You can store, you know, like letters, stuff like that. So I stored your post-it notes that you had from yesterday. الأوراق اللي كتبتوها. إيه خليتهم هنا راح أحفظهم للإكسبيديشن اللي راح نسويه. Yes, that's
Thank you.
technically
You
it.
can produce them and sell to the students.
I don't think so. It's
Thank
just
you so much. In pediatric wards, we can be very effective.
Yes.
Okay. Okay. Other students come or not? No. No? Why? Huh?
Because this day is the last day.
Last day is this.
Finished.
Yes,
Everything
yeah,
finished.
What about
the beginning of this part?
Victor, what about the beginning? This part,
It's beginning.
the 100.
Yes.
The beginning?
I will show you. For this session, this is the beginning.
What about
But
last slide?
I will say, wait and okay. In Iran, if I had in this class like you, Mohsen, I failed all of them.
That's not good.
Okay? We are strict in Iran and not strict here because I am your guest. And I have a ceremony with you.
Okay, you can tell our decision after.
And no,
It's your decision, Victor.
not bad. You are good, but you are irregular students. How are you? Zainab. Every time you wanted to come, everyone. What about Hassanin? What about meat company?
Actually, we will know who will attend.
And also your age is more than students. Why? Why? How old are you? How old are you? 25. All students are above 18, 19.
Saha's 28.
Like most.
I'm 19.
19. Our students in Iran like Mohsen.
Moses,
More
Moses,
than
20.
20,
Not yet.
19.
21.
This is small, okay?
20? Doctor, Mustafa Mahdi.
Ah. Mustafa Mahdi 30.
31.
Too much. And the both girls, how old are you? 25. 20. How old are you?
21.
22. How old are you? 24. 24. Why you come late to nursing?
For me, it was because we were basically traveling from one country to another. So my education was
From
so
Canada?
no, from Norway to Iraq. Before that, I was in Britain. So I couldn't finish my education on time. So it was kind of delayed.
You were in Norway?
I was in Norway and Britain
Why?
because I was born in Norway and then
Okay, as a Norwegian student, I didn't know. Okay. And why you come here?
We came here because it's our country and things were being like kind of bad for my little sister. They kind of like pressure on, certain things that goes against our religion. So we didn't want to stay there for my sister.
All of what is against of Iran. Everywhere that you go to European countries and Canada and America, they say you are terrorists.
Yeah.
How about this
And Iraqis as well.
But
situation in Iran
these days it's disconnected.
Just
I'm lucky that I'm here. Everything is disconnected.
what about your family?
I don't know. Okay. Today we wanted to go to say some subjects about kidney. Do you know where is your kidney, Muhammad? Where is your kidney? Huh? How many kidney do you have? Two. What's the function of your kidney?
We have a lot of functions.
Friendship.
You have a lot of functions.
You went to urology, but
Filtration,
what did you see?
filtration,
Dialysis.
absorption,
Okay?
secretion, and
Okay.
Blood pressure.
and then say erythropoietin.
Okay, very good, Mom. You are a good smoker. You will read our files.
I'm gonna see this,
Today, I wanted to speak about kidney disorder in children. The first is urinary tract infection. Urinary tract infection or UTI. UTI is my question in final exam. Pay attention, we have in dialysis, in pediatric dialysis. Do you have pediatric dialysis? Karbala, Nasiriyah, Arab City.
It's available in all the hospitals in Iran.
Dialysis for pediatric,
Yeah, wow.
special
It's
for
with the adults, especially.
I see in the adult.
pay
in the same.
attention. The adults is different from pediatrics, and the dialysis machine are different. Okay. If urinary tract infection untreated led to kidney damage in pediatrics. Pay attention, that is very, very important. What is this? You know, dipstick. You see it?
Yep.
And about girls, do you see it?
Yeah, yeah.
Dipstick. This is a dip to line, for example, for 5 seconds, and see the color change, positive, negative, invalid. It is unusual test. UTI maybe infection happen in lower tract system, maybe in upper tract system. What is lower tract system?
It's a bladder.
Bladder and urethra is the lower. Maybe infection happen in the lower. Maybe infection happen in the kidney. Upper pyelonephritis, okay? You can see pyelonephritis more in children also. That is inflammation of upper urinary tract and kidney. Can you say the meaning of these words for me? Mohsen, number one.
Asymptomatic bacteriuria.
Number one was bacteriuria.
Ah.
Bacteriuria means
Bacteria in the urine.
number two, asymptomatic bacteriuria. What's the meaning? Asymptomatic means asymptomatic.
It
Means
doesn't have symptoms.
Bacteria urea without symptoms.
okay. You didn't have any symptoms. Is it possible for pediatric? Yes. Number three, Muhammad.
Wait.
Read it.
Recurrent UTI.
Recurrent UTI means number three was symptomatic. Yes.
I can't use right now, so I'm sorry.
Symptomatic.
Simba.
What's symptomatic UTI?
I know exactly what it is.
Now, what is symptomatic UTI? Based on only words, say. Symptomatic means
It has symptoms.
symptom. Number four. Number four. What was your name? Haidar Ali. What was the fourth one? Recurrent UTI. What it means by word?
UTI infection.
You have a children?
Recurrent infection.
Recurrent.
Yeah.
It means when you
Repeated times.
Recycle.
Repeated, recycle. Okay? We have many children in urology ward that have recurrent UTI. Okay?
Yeah.
How are you? Hassane, I missed you.
Thank you.
And the other one, next one is
Continue.
persistent UTI. What is persistent?
Means
we take the medication and treatment of this.
Persistent to drugs, persistent. And the last one, febrile means
Fever.
fever and UTI. These are only words, remember them in the urology ward, maybe you have them. Okay, continue.
Yes. Say something.
Is bladder. If you have infection in bladder, we say cystitis. Okay, what was the first name?
I have
Aya. We have ayat. 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 We have also two ayah. Where are the ayah? Okay, and the other ayah.
It's absent.
Okay, ayat.
Urethritis, inflammation,
Okay, next one.
Inflammation in the upper urinary tract and kidney.
Okay, and this one.
urosepsis,
What is this? Orosepsis.
urinary system,
Tajalli said about sepsis to you, yes?
Yeah.
What's orosepsis?
infection in the urinary system,
Poisoning in the
urinary,
You have sepsis that they cause in
UTI.
yes, related to
bacteria
UTI.
or
UTI system is responsible.
Indeed.
Okay, what the cause? What was your name? Zainab, please read it. Today I wanted you teach me. Okay, cause of UTI. Escherichia coli. Where is Escherichia coli lives in your body? In digestive system. In your intestine. Escherichia coli is. Do you agree? Okay. Okay, continue please. Zainab. Continue. Only read. Don't worry, only read them. You couldn't read? Why? Zainab translate everything into Arabic, yes? Jomana, what's your idea about these bacteria?
Types of bacteria.
Okay, please read them.
Okay, Proteus,
Okay.
Pseudomonas, Klebsiella,
Klebsiella.
aureus, and Anopheles.
The final exam question. Which one is responsible common form of UTI? Which one? Escherichia coli is the first. But maybe we have the other causes like
Doctor,
Escherichia coli.
Staphylococcus is from catheterization in the hospital.
Yes.
Urinary catheterization.
Yes. Number one, E. coli. E. coli is responsible at the first exam question. It is the microscopic. Proteus is the other. Pseudomonas is the other cause. Klebsiella, Haemophilus, and viral. Do you know maybe UTI is related to viral? Yes. What viral? Adenovirus. What about this? This is adenovirus that's responsible for UTI in children. Do you know any parasite? Is it responsible for UTI?
Schistosoma, I think.
Schistosomia or schistosomia. Do you see it? Schistosoma is living in your GI and maybe led to UTI infection. It is possible? Yes.
It is.
Schistosoma. That is a parasite that lives in pediatric, for example, intestine and led to UTI in children. Fungal. Is it possible that fungal led to UTI? Yes.
Especially in women.
Especially in girls. We say girls get UTI more than boys.
Yes.
Yes, doctor.
Where is Mahdi?
Doctor.
Doesn't exist.
What?
No exist.
It's absent.
Absent? Why the girls get UTI more than boys?
Because
Because it short urethra.
urethra.
Because
هذا شو اللي
because
Because of a short urethra. Men.
women
Yes.
get urinary traction more than
the channel?
Yeah.
men. Why?
Because the channel is short.
Child is short.
Yes, shorter. Shorter.
What is shorter? Urethra.
Yes.
What in a neonate period, boys get more. Do you know why? If you have a neonate that is a boy, and the UTI is more than in the boys in the neonates. What do you think? I will say. Incidence, as I said, female children, the urethra is short, about 2 centimeters. In neonatal period, the prevalence is higher among male. Do you know why? In neonates, boys infection, boys UTI is more than girls. What did you say? What do you say?
Ah.
What is this?
This is the reason because
Circumcision. In the neonate period, maybe circumcision. Neonates are not circumcision, okay? Because of it, we have UTI more on them. If you have a boy and he has recurrent UTI, that is better that do circumcision as soon as possible. Why? Because it's responsible for UTI in the boys. Okay? Pay attention.
Doctor, so this is healthy?
Yes. Pay attention. Circumcision is necessary because number 1, prevent of UTI. Number 2, prevent of some cancers of genitalia in the future. The researchers shows that the boys that they don't do circumcision in the future are in danger of cancer in genitalia. Penis cancer, testicular cancer, pay attention. That is better that do this for all of boys, especially in our culture. That is usual that we do circumcision in the first month after birth. Okay, that is necessary. If you have a boy that have fever, that have they have, for example, UTI recurrent, think about maybe because of not circumcision. And as soon as possible, send to urologists for doing circumcision.
Doctor, in Iran, maybe some nurses do it.
Okay, that's not acceptable. In Iran, everything happens.
Everything
But that is too dangerous. We had a boy that circumcision by a surgeon, and the boy had bleeding for a long
Doctor,
time.
they do it with criteria. But they do it, the persons who do it, they have high skills and it's normal.
In Iraq is very thing special, but it's better that do by a specialist. Okay? Do by a surgeon. Do you have in the surgery ward circumcision? No?
Any clinical?
What?
Clinical.
We do in the special urology ward for pediatrics. only maybe for your country also. During neonatal period, as I said, prevalence is higher among male. Pay attention to this. Risk factors. Number 1, urinary stasis. What it means? For example, also for us, for our students in the class, also for other schools, primary schools, high school, okay? Some of the girls and boys get their urine and they don't go to the bath in the time of they are in the school, and we say urinary stasis for a long time led to UTI.
Yeah.
Okay? Pay attention. You as a student go to the bath frequently when they are in
2
the
hours. Every 2 hours.
every 2 hours. We couldn't say any program. If it is depend on your situation, but some students didn't go from morning up to evening. That's not acceptable. Led to UTI. Also in women students, pay attention. That is very important. Number 2 is vesicuro-urethral reflux. I will say to you about it. And anatomical risk factors. I will show it to you. Sometimes, for example, we had children that he had recurrent UTI. After sonography, we found that this baby had 3 kidney, 1 in the right and 1 in the left. This is abnormal anatomic situation that led to
Doctor,
UTI.
can this person donate this kidney?
No, these 2 kidneys are not normal. They are smaller than not normal and full of anomalies. Pay attention. These are anatomical.
You cannot divide these 2 kidneys.
No. These are not normal. They stick to each other and they very abnormal kidneys. Okay?
Doctor, also we have, for my youngest sister, okay, she has a U-shaped kidney.
Yes.
It's called horseshoe kidney. Also, she had a recurrent UTI with febrile.
This is anatomical.
Anatomical abnormality.
Yes. 2 kidneys in her sister is connected with each other as a horseshoe. Okay, this abnormality.
Also,
They have UTI.
UTI.
Recurrent UTI.
and every 3 months, I take it to do a lab test, or especially for culture.
Okay. These are anatomical system that's led to recurrent UTI. It is possible, yes. We check UA. Do you know what is UA? The most important laboratory test for urinary tract system is UA. Checks for protein, white blood cell, bacteria, okay? And we have urine culture, detect bacteria, viral, parasite, virus, everything. We send UR, UC for all of children if they have any problem about kidneys. It is clear?
Yeah.
Clear.
Diagnosis of UTI is based on number 1, dipstick. I showed it to you.
Yeah.
UA, UC, and what about 3, percutaneous kidney tap? Do you know what is this? What's the meaning by word?
Indication.
Second, what's the meaning of
Indication.
word? Number
Maybe,
3, percutaneous means
biopsy from by
not biopsy.
like a biopsy.
Yes.
Entering the subcutaneous and take it from the kidney.
Not kidney.
They take it from the urethra, dipstick.
Yes.
So it's like you know, a Q-tip but it's like something else, and it's long. They insert it in the urethra, and they take like a swab, just like they do for corona.
Not urethra. Go to bladder. From suprapubic by a needle.
Yeah.
Doctor goes to bladder and get urine for sending to laboratory tests. Okay? He say percutaneous kidney tap. The other diagnosis test is BCUG. Do you do BCUG for your system? BCUG. This is a test for detecting urinary system. That is voiding, stands for voiding cysto-ureterogram. They put a Foley catheter for the baby and send to this Foley catheter some specific substance in radiology and take some picture.
Yeah.
Doctor, they diagnose it with ultrasound.
It is for all of urinary system, not only for your sister, okay? The other one is IVP. Do you know what is IVP? Intravenous pyelogram. It's common for adults. If you have any problem, for example, go to radiology, they inject some drugs for you and take some pictures of your kidney system. And we have the other test, DSMA scan, okay?
Yeah.
Nuclear scan. Do you have nuclear scan also in your country?
We
In
don't
Karbala?
We don't know.
I don't think so.
Ah, I think you have. Where is Zainab? From Baghdad. Absent?
She go to the Baghdad.
Go to Baghdad.
Yes.
I wanted to ask about DSMA scan in Baghdad. Do you have?
I don't know. I don't know the hospitals there, so
Okay. Maybe you have
maybe we have.
dimercaptosuccinic acid. They inject you radioactive drugs and get picture of your system.
Yeah.
DSMA scan. What is this? That is a radiography, and you can say kidney, urethra, bladder, and maybe this is a IVP, intravenous pyelography, for checking urinary tract system. The sign, fever.
Related to the infection.
Final exam question. What is the most important sign of kidney disorders, especially UTI in children? Only fever.
Yeah.
The
Again,
mother says to you,
the question?
What is the most
what's the most important cause of UTI in children?
Cause or
Sign of sign. Cause was Escherichia coli #1. Sign fever #1. You have a boy, for example, every time he had fever without any sign and symptom maybe. At the first we think about UTI. Maybe pain, maybe urinary incontinence, foul and smelling urine, too bad smell the urine have, and urinary frequency. He's a student that say all of time I wanted to go to the bath.
Yeah.
I said maybe you
Just,
have
just
a
feel
UTI,
like
maybe you have an infection.
it's just a sensation of
Fully.
and burning, but they don't have a urine.
They have the sensation of fullness.
It is about children. Full or smelling?
No,
No, I mean
in the
the
bladder.
this urinary frequency.
Okay.
They just have sensation of
No, maybe go. Some children in the, for example, primary school, the mother says, the teacher wanted the of mother that go to the doctor. I said why? He said my children has urinary in the class. Why? Maybe this baby have a problem, a UTI.
yeah.
It's better to check kidney system about these girls or boys. Pay attention in the schools, in the hospital. Pay attention to urinary frequency, also for yourself. For example, you have a grandfather, Haida, and he said to you, I have frequency. Every time I should go to the bath. Your grandfather. What do you think about? Do you have grandfather? No?
Excuse me, doctor.
Who has grandfather? Do you
Taha
have
said
grandfather?
I go to the toilet frequently. Yes, you.
Taha?
Taha, yes.
It's better that check. At the first,
It's a normal situation. The person should avoiding 8 times a day. That means every 2 hours.
pay attention. Sometimes some grandparents, some older person, older children, about Alzheimer person, it's
They forget and they
or diabetes, yes. Every time you have problem in frequency, is it to go to find the cause?
Yeah.
Every cause may be happen. For example, for grandparents, everybody have grandparents. Hassane, do you have grandfather? No? Every grandfather have died? Nasiri, do you have grandfather? All of our grandfather is alive.
I have the life, the normal life in Iraq, 60. 60.
Who in this class have grandfather? Muhammad, you have grandfather?
My grandfather passed away from 10 years.
Just the grandmother.
You have grandfather? Grandmother.
Grandma.
Grandfather is very important because in the older age, the man have prostate. You know? Prostate. Inflammation. Inflammation. Okay, what was your name? Al-Mahsan. Alvin.
Ali Tahtan Shibli.
Last night I think about your family. Do you have family name?
No.
Yeah. If, for example, my father and my grandfather is like you, what happened?
We do, but our typical system is your name, your father's name, and your grandfather. We don't usually mention their family.
Okay, you didn't have family.
We do have family.
What's your family?
We have, of course, one.
Shibli.
Lehendi.
Yeah. What's your family?
Hussein.
Family. Sad. Family. Family. You have family, right? Yes.
We have family.
In the grandfather, in the older age, we have hyperplasia of prostate. Be awareness, boys, about yourself in the future. You have maybe cancer of prostate, cancer of testes. When urology work, you see these patients? No? Yes? In oncology, you can see some prostate cancer, some Urinary frequency, pay attention to it. If you have problem, it's better than go to urology and do UTI, infection, sonography, and step by step do some tests to confirm what's the cause. Pay attention, many of them may be missed and led to damage of kidneys. You go to dialysis and you see some patients that they damage their kidneys because of not pay attention to sign and symptom of urinary tract system. What's the treatment?
Antibiotic.
Antibiotics. What antibiotics? What? For all based on the culture, number one, based on the culture, not for all of UTI we use amikacin. We use different based on the culture, okay?
Doctor, so once we know that there is a UTI, but we don't know what type of bacteria it is, can we use broad spectrum antibiotics?
No, we wait for coming the culture result, and in culture result, the laboratory do antibiogram. You see it?
If it's viral.
If it is viral, we didn't have any treatment for them.
So
Maybe some antiviral drugs that maybe you have in your country, we didn't have. Because we are in sanction, and you maybe not. Pay attention. Viral UTI is not very serious because it's cure itself. Okay, treatment is antibiotics. If parasite, antiparasite. Based on the cause, we use antibiotics and drugs. This is circumcision. That's based on specialists do. And what is nursing intervention? At the first, all places that you are, the first thing is vital sign. Okay, read please this.
Okay. Monitor vital sign, especially fever. Record intake and output carefully. Observe for sign of soreness, infection, flick pain, high fever. Monitor for dehydration.
You as a nurse, it's very important that pay attention to these things. Vital sign is important. Fever is a sign, and intake output check, and the hydration is very important. Pay attention to this. And do you have any question about UTI? UTI is a good prognosis disease, and many of patient doesn't have any problem in the future. Only detecting and treatment. Okay?
yeah.
We will go to number 2 title, that is VUR. Do you know what is this, Mohsen?
I do not know.
Based on the meaning?
Reflex is when the urine go back to the back of the
So
kidney.
it's like a regurgitation.
Okay, like regurgitation, but we say reflux.
Yes.
That is very common. In urology, pediatrics, VUR. Vesico means bladder, urethra means, reflux means go back. Okay? What did you see here?
The reflex from bladder
To urethra. VUR. Why it happens? What do you think? What do you think? What's the problem? Infection. Compared to urethra with each other?
Reflex. Reflex.
anatomical, you can see this is different than left one, okay? Anatomy of urethra is different and that is congenital and led to reflux. Are you agree? VUR, vesico-urethral reflux. What happened when you have reflux?
Kidney injury.
Urosepsis.
Kidney injury, very important. And urosepsis, infection. Okay? Maybe your sister have reflux.
No, she doesn't have.
Doesn't have
Yeah, but she has kidney stones from the.
stones?
Yeah,
Oh.
especially in our family, I think it's genetic and idiopathic in the same time.
Okay. This is VUR, pay attention. You go to urology ward, to pediatric ward, and the mother says, my daughter have reflux, and the cause is congenitally and genetic, and sometimes this is secondary. For example, you have diabetes person, you have meningomyelocele, you have neurogenic bladder. Pay attention. We spoke about spina bifida. Do you remember?
Yeah.
Many of them have neurogenic bladder. Do you know what is neurogenic bladder? Maybe Taha have neurogenic bladder.
Maybe Taha said he has kidney stone. The boss. A kidney stone, so that's why maybe he has to go to the bathroom.
He used to do frequently.
Maybe you have neurogenic bladder in some children that they have meningomyelocele. Frequency is in these children more than. Okay? The mother said to you, my children have VUR grade 3, for example. Could you explain with me what did you see? What did you see? This is reflux. Reflux, okay? And this is urine.
It's in the.
These are grade of, different grade of VUR.
So
Okay?
1, 2, 3,
The mother said to you, my grade of my children is about 3 or 4. What it means? What it means?
Can you again,
What it means? Zahra, what it means? What did you see? The yellow color is urine. In the third one you see, third one, stage third, grade third, you see? This is related to reflux, okay? In number 1, the reflux is needle, for example. Grade 2, the urine reflux is under the kidney, but it is mild. In grade, for example, 3, it is more than. And in grade 4, you can see reflux too much. And in grade 5, you have all of VUR in the kidney, that is damage the kidney. If you have reflux, they lead to damage of your kidney. In children, that is a disaster that you have VUR. This is congenitally anomaly. What do you think about treatment? Could you change the slide, please? Could you change the slide, please? What the treatment do you think about? Surgery, what do you do for this urethra?
Doctor, the main problem is contraction of the bladder or
the urethra, anatomy of urethra has problem. The sphincter between bladder and urethra problem. The urine comes out to the urethra very easy.
Can we make a stent or something?
You didn't have stenosis. You have an sphincter between bladder and urethra, and this valve closed. But in these children, this valve doesn't close, and they have, you see, anatomical urethra. Okay, anomaly.
So I think
What happened?
I think
What?
it's better make surgery and cut the
Surgery.
and he can
Okay, please show me surgery for grade 5. Cut it
and do another
change it.
another urethra
Yeah.
from where?
but we have to so we do last one.
Cut this urethra
Yeah.
anastomosis.
Yeah.
What about this one?
Okay, that's good one.
What's your idea?
We close.
I think we should fix the underlying issue, which is the valve or the sphincter you spoke about. So if we have to like give medication that helps with the valve
Medication,
closing. Yeah.
surgery. We couldn't do anything about this urethra. We have artificial urethra that comes and connect. We didn't have. We use drugs, antibiotics for controlling fever, controlling infection. Sometimes in pediatric wards in Iran, we use Botox. Do you know what is
Yes,
Botox?
yes.
It's usually in your country.
Yes.
Okay?
For the face.
Botox, you know what is Botox? You can know.
So it's like a toxin for the muscles.
What do you think about injecting Botox in the urethra?
I think it's
In Iran, we have special structure that inject Botox to this urethra to
relax.
relax it, to heal and anatomy structure correct.
Doctor, but in Iraq we use it for the face.
Yeah. On body.
Pay attention, if you have urology ward for pediatric, your doctor do this.
That's why yes, we do this with germs.
Yes.
The germs, they doing
They do it
Yeah,
for
so
the
what's
digestive
the
system, not.
Oh, for GI? No, for urology. Maybe GI do.
Also, we take it, we put in Botox here because there is a dilation. When when there is a dilation, the esophagus opening is the hormone dilation.
I don't know about your country, about the other, but I sure because we do injection of the Botox in grade 3, 4, and 5 for getting anatomy and straight of urethra. It is effective. Every 6 months, the children comes for injecting Botox in urethra.
Pediatric urologists, it's especially in Kabbalah, they are fewer.
Fewer,
Yeah.
okay. Go to nursery. They have 5 nursery. Don't worry.
I think in all of Iraq country, they are fewer, not like the adult urologists.
Oh. Come to Iran, please. We have specialists for this disease.
We have a
We have
specialized
neurology.
surgeon.
Urology, pediatric urology, you have. Okay, please change the slide. Go and change the slide. You are tired.
Sure.
Botox, what is this? Maybe.
The quality of the medical service in Australia is very, very low, you know.
Very low.
If you go to the Australia, you will die.
Nursery, please look at. He says your medical situation is very low.
Because he had the like this.
Excuse me, doctor. If you want,
In Kabbalah one hospital, and last or two last years. Yes, and Nasri 5 hospitals. And one hospital
And
is
one
hospital.
Great Karbala, Nasriya,
If you want,
Doctor.
Because Muhammad has some problem with that. Some people
The first heart transplant of Nasri.
all of you are good. What are your idea, Hassan? Nasri is better hospital for Karbala.
Especially the private hospital. They have private hospitals related to the
Excuse me. Excuse
That
me.
was good.
Excuse me. Ask the all residents here. Which better, Karbala or Nasri in the medical service?
What is here?
Ask the students here.
I
didn't go to
wanted to make a quarrel with you, Nasri, Karbala, and killing each other. But I wanted to say to you our country's experience. We inject Botox for treatment of VUR in our children, remember it? And be friendly with each other in all of hospitals. You are nursing friendly. You have this grade of VUR that is congenitally, the cause is unknown, we didn't know, that is genetic, and the only treatment is antibiotics and injecting Botox sometimes, and you can see hydronephrosis. It is an expression that we use. Welcome, how are you? We have hydronephrosis in the documents. Many doctors said to you the children have hydronephrosis because of VUR. What did you see? What did you see? This is a VUR, vesico-urethral reflux, that's showed in the radiography. This is a kidney that is not normal, and this one is enlarged and full of urine. Oh, yes. This technique is by a special substance that inject that in radiology done. This is some anatomical disorder that you can see in radiography. This is a bladder that is too big, and the urethra and also kidney, they are anatomical problem. You can see reflux also for these children. The sign is fever and pyelonephritis recurrently.
Yeah.
Fever is very important in children. Pay attention, maybe the sign of kidney disease. What's the treatment? Antibiotics we use. You see every 2 to 3 months. Every year we used VCUG. And surgery, we have a doctor in Iran, in some cases, cut part of intestine and graft to as a urethra for some children. And sometimes they produce urethra in the laboratory. Okay? They get one cellule of the baby and they culture this one cellule in the laboratory, special laboratory, and produce a urethra, and anastomosis instead of BUR type. Okay?
Okay.
We say transplant urethra.
But it will be very expensive. So expensive.
Yes, it is done in Iran also, transplantation of intestine instead of urethra, or culture of one cell and produce a urethra.
One urethra transplant.
Yes,
Just one?
yes,
The affected one?
yes. If need, if it is, we are also bilateral, we do bilateral.
So what is the complication of the graft?
Because the cell that you get is from the child, that they are autolog, it is good.
No.
The donor
You
is
mean
children.
we're taking the tissue from the intestine to the urethra?
Yes,
So
intestine of the
this-
children.
The system is different.
Yes,
So
yes.
what's the
What they do?
complication?
What
The
they do?
complication.
Infection is many complication. We didn't have any rejection, for example, because intestine is related to children also. A part like a line, cut it and anastomos.
Line, not just line.
A part of intestine. Cut a part of intestine and transplant to urethra. Cut urethra. Pay attention, for example. You have this urethra, okay? You cut a part of intestine and cut it and anastomose it. These two places, okay? Transplant, okay? Transplant of intestine to this part as a urethra. Maybe infection is the most. Surgery is this buttocks, and you can see here sometimes they are bilateral BUR. We have bilateral, maybe in one lateral. Which one is the worst?
The bilateral.
Bilateral. Damage all of kidneys and dialysis. We can see children in dialysis. The mother said, my children has BUR, because of it we are here. What happened? Damaged kidney because of reflux. This is aspiration of urine from suprapubic. You know where is your suprapubic?
Yes.
Some doctors in urology ward get sample of urine from suprapubic that is clear than fully catheter, clear than normal getting UR and UC. That is better.
Yes.
You do it?
No.
No? Okay, do you have any question?
No.
Something that I forget to you last session about Wilms tumor, what 2 points that are in my exam, final exam, is chemotherapy in Wilms tumor. We do pay attention. These are drugs, only see them. Doxorubicin, vincristine. You see these drugs in oncology, okay? And vinblastine, based on the some points that I wanted to you is touching, it's missed, touching the Wilms tumor by you and by doctors is banned because of rupture of the mass and metastasis to other places. This is a final exam question. I will say to you, touching and examination of Wilms tumor by nurses or doctors is banned because of maybe to rupture and metastasis. Okay, what time is it?
9, 10.
8 past
try to do it, not early.
Already yesterday we complete at 11. So can we continue?
Okay, if based on my file, if it's finished, you can go, okay? In the urology ward, you can see girls like this. What do you think about them? What do you think about this disease?
Edema.
Edema and puffing around eyes, that is nephrotic syndrome. Are you heard?
Yes, the protein.
Yes. You know eclampsy, preeclampsy, yes, okay?
Yeah.
This is like that, but it is about children. You have nephrotic syndrome. Nephrotic syndrome is a kidney disorder characterized by increased glomerular permeability leading to massive protein loss. These children, these girls and boys have protein loss, like eclampsy and preeclampsy. Do you remember them?
Yeah.
They have protein in the urine, and also about these children, they have protein in urine, and also hypoalbuminemia, edema, and hyperlipidemia. Do you know about eclampsy and preeclampsy? It's like that, especially for pediatrics. Age of 2 to 7 years is more than, boys is 2 more than girls. In children, we have many diseases that boys in danger of eat more than. Why?
We don't know.
Unknown. We didn't know. Why? Glomerular damage.
Protein.
Why happened glomerular damage? It's unknown. But they say immune system may be attacked to glomerular and led to damage. Researchers showed that immune system attacked to the glomerular and led to proteinuria, hypoalbuminemia, and decreased plasma oncotic pressure. Do you have why we have edema?
Yes.
Why?
The fluid shifts from the inside to outside.
Okay, we
The
have edema.
oncotic pressure is lower.
Okay,
So the
like eclampsy and preeclampsy. And why we have hyperlipidemia?
the body tries to compensate the amount of protein that
Protein and led to hyperlipidemia, and they are in the risk of infection.
Yes.
Why?
The antibody is induced by protein. The protein is antibody.
Okay, decrease immune system and led to increased infection risk. Great. You can see children like these, edematous, that comes to your ward, and you think maybe it is nephrotic syndrome.
Yeah.
For confirming, if we have different kind, maybe primary, maybe secondary. We had twins that one of them was congenitally nephrotic syndrome.
Yeah.
The other one,
Secondary to other diseases like lupus.
this is genetic, okay? One of them have nephrotic syndrome, the other no. What happened? Immune system, genetic system, it is important. Maybe it is primary, the cause is unknown, we didn't know.
Yeah.
Maybe secondary, maybe diabetic person in the adults also, maybe they get nephrotic syndrome. You can see in the nephrotic or nephrit urology ward, you can see puffy children, edematous children, moon-faced children, because of using and because of hormones they use, you have seen moon-faced for them. This is a nephrotic syndrome.
Yeah.
The cause is unknown, viral, immune factors. This is a boy or girl that is, yes, because of edema and sometimes cortons, you can see they're very fat and edematous. What is the sign? The age is 2 to 6 years. Edema is around eyes is very important, and genitalia edema, and also general edema. All of them. In the boys, especially genitalia edema, we have also. You can see the edema to children in. The sign is fatigue, ascites, hydrothorax, pale edema, and infection, especially in respiratory system, may be happen. What is hydrothorax? Hydrothorax. Hydro means water, thorax means thorax. Okay. When we say hydrothorax, you have, what is this? Ascites in nephrotic syndrome, and you have hydrothorax, okay? The water in the pleural is increased, we say hydrothorax. Diagnosis is with lab test and biopsy. We use some lab tests like protein, some renal function tests, and also immune system tests. And we confirm that we can use biopsy of kidney. In urology ward, in oncology ward related to urology, we use. Yes, these are general lab tests. Especially biopsy for confirming in some centers do you see biopsy? They goes with a blood and long needle go to the kidney under surgery in operation room to get a biopsy and confirm it, but it's not usual in children. Sometimes some doctors do. Maybe in Nasiriye, in what city you are in Karbala do by nurses? Maybe it is in Karbala, maybe everything maybe do by specialist
No,
nurse.
it's doing by the physicians.
Doctors, what he said.
No, just physician doing this one.
Pay attention. This is an edemato and puffy boys that's maybe nephrotic syndrome and under treatment. What's the treatment? Pay attention, I said it's related to immunity. Because of it, it's better that we use cortisone, prednisone, cyclophosphamide, albumin, diuretics, okay? These are drugs that we use for supportive and treatment of nephrotic syndrome children.
What about the third one?
Third one, albumin, cyclophosphamide is, no, it's immunosuppressive drugs that we use especially oncology ward for cancer patients. Okay, if your children doesn't answer to prednisone and prednisolone, the third step is using these drugs. These are more invasive, but we forced to use them. Cyclophosphamide is the third one, okay? In special. Sometimes they use some chlorambucil. This is related to cancers wards, but sometimes we can use in nephrotic syndrome that they don't answer to cortisone. Pay attention. It's special. Prednisolone, cyclophosphamide, sometimes we use for them in special. Albumin, it is very expensive, you know.
Yes.
That is
120 dinar. Iraq.
dinar, and in my country about 8 million to 10 million. This is too expensive, but that is necessary for nephrotic syndrome patients. And nursing. Vital sign is number 1. Read please nursing. You are the nurse, please read this. Nursing care for pediatric nephrotic syndrome. Number 1.
Monitor vital signs. Regularly check blood pressure, heart rate, respiratory rate, and temperature. Watch for signs hypertension or infection.
Okay, go and change the slide. Number 1, vital sign. Pay attention. Pediatric ward, pediatric disease. Number 1 for all of them is vital sign. Okay. Number 2,
Monitor white. Record
why we
daily.
monitor, right?
Because edema.
Edema. Okay. Read this.
Record daily white to assess fluid retention and edema. Track change to guide diuretic therapy if
It's
prescribed.
necessary for diuretic. Okay. Use for edema. Okay. And go to
Monitor sodium intake
why we monitor sodium,
because
Edema.
edema, and also diuretic that we use. Okay. Hypertension. Okay, we say we have hypertension. Why we have hypertension?
because we have
Sodium
high sodium.
attract the molecule of water on
Okay, water and sodium with each other move, and increasing water means increasing sodium in your body led to hypertension. Monitor sodium intake, okay? And
Preventing
why we have infection in these children?
immunosuppression.
Immunosuppression, pay attention, because they use cortisone. This is immunosuppressive and led to decreasing immunity. Prevent infection by how?
hand hygiene and monitor for fever, respiratory symptom, or another sign for infection.
Pay attention, vaccination in these children is very important. Some of doctors stop vaccination up to treatment. Okay, pay attention. These patients have low immune system. And we have twins, and the doctor said, please separate these two twins with each other because of infection, and not vaccinated these children up to treatment complete. Okay? Go to the other one. Okay?
Educate family
Read it,
about
please, you.
okay.
Come, sit down, thank you.
Okay,
Please
so
read.
educate family about the medications, explain purpose of corticosteroid and other prescribed drugs. Teach the importance of the adherence to prevent relapse.
Pay attention, some mothers decrease the drugs, not use the drugs, and let you relapse, recurrent, and damage, and you have some pediatrics in dialysis that they do dialysis because of nephrotic syndrome. Why?
The drug convenience is not
Compliance of mothers and using drugs very important. Okay, go and change the slide, please. These are simple but very important. Okay.
Read it. Educate family about the side effect of the medications, corticosteroid, weight gain, mood change, increased appetite, hyperglycemia, diuretics, electrolyte imbalance, dehydrations. Monitor for any adverse effect and report promptly.
You know what's the corticosteroid complication? We said Cushing. You know Cushing? What is Cushing syndrome? You know Cushing syndrome? search it. Everybody that use Corton for long time be Cushing. Search it, yes, Cushing syndrome.
Cushing syndrome.
Yes, maybe
It's a disease in the.
sit down please and search Cushing.
It's a disease in the GI.
Makes people
You see, Cushing syndrome.
Obesity, around the face, legs.
In the transplant bars, you can see Cushing syndrome also. You see, because of using Corton, they are good face, they are increase their weight. Please see the face, the shape of Cushing. You see, you search it? Okay. You know? You see the back of Cushing syndrome, search it, please see them. They are appearance. They have an appearance that they are fat and special face. Okay? See this Cushing. See Cushing. You see them? Search please. Yes, Cushing. And go and change the slide. Go and change the slide. Pay attention, treatment is for more than 6 months. Okay? Okay. Read it, please.
Monitor urine for protein. Regular urine tests to detect proteinuria. Teach parents how to observe urine at home. For they or foamier urine.
What does it mean?
Okay.
What does it mean?
We have to dedicate parents, the family to do test for urine proteinuria. I think بس شو نسوي؟ اعتقد هذا الكلام الذي بيقيس البروتين.
Lipstick, they do it themselves, okay? They check protein in the urine. Okay, you see that? Okay, this is Cushing syndrome. In the nephrology, you can see nephrotic
هذا مرض جديد.
is checked.
خلاص.
You have a nephrotic syndrome or surgical one. Yes? No? This is special. Okay.
That's enough.
Next.
Okay,
Time is finished.
I see nephrotic syndrome is prognosis is, read please.
Prognosis.
The mother said about
Prognosis,
the
good
prognosis.
at response to drug, poor in responsive to cyclophosphamide. Yeah.
Good if response to drugs and control proteinuria, and that if not accepted to the drug up to you see to cyclophosphamide and also not response. Okay, this is okay, it's finished.
Finish?
Do you have any questions?
No.
Okay, go to the edema.
Here?
Next.
Here?
Okay, okay.
Here?